Hi, everyone. I'm looking forward to talking more about pot self-advocacy today. And if you are living with a poorly understood chronic condition that isn't POTS, I still believe that much of the content will be beneficial and applicable. I view self-advocacy as a non-negotiable requirement for individuals living with chronic conditions like POTS, and I'm going to expand on this firmly held belief of mine during this presentation. First, let's start with a quick story. So, about a month ago, I had plans with a friend who knew about my chemical sensitivities and asthma. We were looking forward to seeing one another. She traveled far to see me, and when she got to my home, she had perfume on. We were both wearing masks, and I hoped that the air purifiers in my home would be enough. Against my better judgment, I didn't tell her that she needed to leave. I didn't want her to feel bad. Sure enough, later that evening, I had a severe asthma attack and laughed at myself as yet again I learned the hard way. I put her comfort before my needs, risking my health and safety. So, why am I telling you this? Well, I am far from perfect, especially when it comes to self advocacy. And though I've made large improvements and strides in this area, my challenges have allowed me to better understand the obstacles that the community faces, that I face, that those with chronic conditions face. And I hope that speaking from that perspective today will be really helpful and beneficial. Here is a quick breakdown of all of the self-advocacy specific topics that I am going to be covering today. So I think that we first need to review the unique and shifting needs for those with POTS as compared to individuals who are not living with this condition. And it's applicable for individuals living with other chronic conditions as well, particularly those that are often stigmatized and poorly understood. I think that this image of Maslow's hierarchy of needs does a really good job of reinforcing just how many changes that we experience in significant areas of our lives. It also reinforces how our safety can depend on our ability to advocate for ourselves and how unsafe it may be if this is an area that we struggle with. If we are surrounded by people who dismiss our physiological needs, that is dangerous for us, and it often does not stop there. Some may be wondering why I'm so passionate about this topic and why it's so important to talk about. I want to review some concerning poll results from some questions that I posed to our community about a year or two ago. If this doesn't concern you, I'm not sure what will. It's terrifying to know that we have this many people living with POTS who struggle to trust medical providers, report experiencing medical trauma, and report struggling to get help in ER settings. Some of you may be thinking, well, this isn't reliable data. How do we know that this is accurate? And although this is a reasonable question, I would ask in response, what if it is? Not to mention that some of these reported findings are consistent with findings in published and peer-reviewed studies. I think it reinforces what those living with POTS experience in medical settings, and we have a responsibility to provide the community with the tools that they need to advocate for themselves in informed, empowered, and impactful ways, regardless. I would like to review a few examples as I've mentioned the safety risks when surrounded by those who are dismissing needs, especially if you struggle with self-advocacy and live with a chronic condition like POTS. The first example discusses a situation where someone has been fainting at school. They need accommodations, and if this need is not met, the risk for fainting and serious injuries, such as head injuries, increases. The second example reviews a situation where someone with POTS has been struggling to walk and shower, secondary to pre-syncope. They need access to supportive treatment options, specifically medications, but their medical providers think that they are being dramatic and emotional. This increases risk for falls and serious injuries, and it is yet another obstacle to needed and supportive care. I've provided examples that reviewed risks for harm and the importance of self-advocacy, which is a great idea and seems easy until we unpack some of the challenges, obstacles, and how dismissal may be having an impact, in addition to experiences of trauma and other aspects of our life that may be contributing. It is not surprising why the profound and traumatic impact of dismissal in various settings would contribute to less self-advocacy, less empowerment, and more isolation. Some in the community may make calculated decisions, feeling that the risk of dismissal when they advocate for their needs is more painful than struggling through and minimizing symptoms they may be experiencing or challenges they are experiencing in academic or other settings. They may mask their symptoms and how they're feeling because that seems easier than experiencing reactions from those around them. They may be minimizing what they experience because it increases their likelihood to be believed and perhaps not experience even more losses. So, what's within your control? There is a lot that needs to change, and I could go on and on about all of those pieces that include provider education and likely create many presentations focusing on that exclusively. But right now, I want to talk about what you can control. Sure, you may be able to influence public policy through advocacy efforts. You may be able to advocate for medical education changes, but you do have limited control over what happens. When placed in situations where our control is limited, it can be empowering and grounding for us to focus on what we can control. You can't control how others around you respond to your POTS. You can't control that you developed POTS, but you can control how you respond and show up for yourself. Here's a visual that I developed, which may seem simple, but I think it effectively gets the point across. We can't control the rain. And here, that includes others' biases, your POTS triggers, hospital policies, things that you have lost, medication reactions, and how others respond to you. Yes, you may be able to make decisions and take steps that limit their impact, but you can't control them. You can control your umbrella, which includes the boundaries and limits that you set, how you respond to disrespect, how you prioritize your needs, how you listen to your body, how you choose to show up for yourself, and who you choose to trust. POTS self-advocacy allows you to represent yourself in a way that claims your space, needs, and voice, allowing you to take back your power in situations that could otherwise leave you feeling helpless and voiceless. It allows you to show up for yourself in an empowered and influential way. But is it easy? No, not at all. I shared that story earlier in the presentation for a reason. But I firmly believe that with the right tools, all of us can improve upon these skills, perhaps in ways we didn't expect or imagine. I would like to review some important self-advocacy truths listed here. Self-advocacy is a critical topic, but it can be challenging because of how many variables need to be considered that can influence what is best for us. There may be general guidance, but there's no one-size-fits-all approach to self-advocacy. There isn't a right way or right answer. It really depends on your history, your needs, and what is best for you individually. When effective, it allows you to honor your truth and reclaim your power. And patience during the process is key. We aren't looking for perfect, we're looking what is right for you. The need for assertiveness. So part of effective self-advocacy involves assertiveness, not aggression. There's a big difference between the two. So aggression can negatively impact your physical and emotional safety, but assertiveness can increase your emotional and physical safety. It allows for everything listed here, especially with that empowered and compassionate stance. Assertive doesn't mean mean. You can make space for your experience and confidently assert yourself without dismissing or minimizing the other person. This can be very challenging when we are triggered, and it can feel strange if it's new to you. But with time and practice, like with anything, I firmly believe that it can get easier. In the early stages of developing my assertiveness skills and using my voice, asserting myself felt mean. Was it mean? No. But I personally had large hurdles I needed to maneuver over. So being mindful of what your hurdles are and will be is critical. And please, again, be patient with yourself. This is a process. The use of I feel statements. So when in doubt, I feel statements can be a great place to start. It can be easy to slip into accusations like, you never listen, or you don't believe me, or you never believe me, which can very, very quickly escalate into a less safe situation where defensiveness from the other person, just as one example, can cascade into more reactivity and less communication. I feel statements can offer an opportunity to share your experience and truth while increasing the likelihood that what is shared isn't accusatory and is heard by the person or people that you're talking to. I recommend taking this a step further with a mental health professional who can really unpack what this looks like for you, personalize the approach, and offer more resources and practice. So, I believe that an important part of self advocacy involves increasing the likelihood that you are heard and what you're sharing is received by the other person. This means that nonverbal communication also needs to be discussed here briefly. So, here are a few examples of inaccessible and accessible communication. But please note that depending on other conditions you have, some of these may be out of your control, uncomfortable, or very unhelpful. Cell phones are a big one here, as one study found that even having a cell phone out and visible during a conversation significantly impacts communication. But again, all of us are different. I really want you to defer to what's best for you. Let's go ahead and dive into some of the self-advocacy acronyms that I've developed to help with this skill. So the first acronym here is the CHOICE acronym, which I like because there are many things during this journey that we can't choose. Remember that self-advocacy is a choice that can be an empowering first step. I broke this down into 6 steps that require you to consider the situation that you are in, check in with yourself about how you are feeling. You could do this by writing something down, using the notes app in your phone, or silently thinking to yourself. Reflect and consider how you're feeling and observe without judgment. This can give you time to ground yourself, evaluate the situation, and reflect on what you would like to say, and set the stage for a healthy conversation if you feel that it's safe for you. From there, you can initiate the healthy conversation, speak your truth, and I always encourage self-care, processing, and recovery after self-advocacy. This could look like a meditation, journaling, therapy appointment, prayer, listening to music, spending time with a furry friend, or all of the above. So let's review a case example. And I know that this may seem easy, but I can guarantee that it is much more challenging than it appears for many of us. Take a moment to read through this question and select the answer that you feel is best. Okay, so I'm going to go ahead and move to the next slide, which has the answer. I apologize if some of you are still working on the question. We will have these sessions recorded. I want to make sure that I fit within the needed time frame today. So here we go. The best example of men assertively advocating for what they need can be seen when looking at answer choice A. The other answer choices either minimize their symptoms and needs or demonstrate them avoiding the social gathering instead of speaking their truth. The first example honestly states that they're in a flare-up, that they need a place to sit in the shade if they go, and asks if this is possible. Let's review a second case example. So I'd like for you to again take a moment to read through this question and then select the answer that you feel is best. Okay, so I'm going to move to the next slide, which has the answer. So the best example of Maria assertively advocating for herself can be seen when looking at answer choice D. A, B, and C involve Maria minimizing her experience to agree with the provider who does not believe that her symptoms are challenging for her. In many ways, she is swallowing her experience and truth when dismissed by the provider. If you've responded in this way during your journey in an appointment or other situation, I do hope you know that it's understandable and makes sense, especially given how our community has been treated in medical settings. But just because it makes sense doesn't mean it's fair to you or okay. And the last answer choice, while very difficult to say in the moment, allows Maria to stand up for herself, her experience, and her body. So that last question is a nice segue into this next topic, which focuses specifically on self-advocacy in medical settings. And it's true that the dismissal experience in medical settings can lead to pain that can worsen health outcomes and quality of life. This doesn't mean that it's easy, and I would argue that this may be one of the hardest settings, yet it's also one of the most important in my opinion. Challenges in this setting include the long history of negative experiences. You're potentially in an unfamiliar environment. There is a power imbalance and some potential loss of control over care. And on top of all of this, there can be a loss of trust and a poor sense of safety. Your body and nervous system hold on to trauma, so your body may be making it clear and remembering that if you haven't been safe in that environment before, it doesn't and can't feel safe now. Considering the unique challenges that many with POTS experience in medical settings, I developed this You First self-advocacy acronym. So this involves the reminder that you deserve to have positive experiences in healthcare settings. I believe that they've been traumatic, but that doesn't mean that we should normalize that or that it's something that we just need to get used to. This also includes organizing everything that you need, like medical passports, documents, using resources available to you whenever possible, searching for supportive providers. Sometimes there are lists in community support groups or within other organizations that can help. And then it reviews how to initiate healthy conversations using the CHOICE acronym reviewed previously in this presentation, requesting accommodations for procedures and appointments, and highlighting the critical importance of safety. Please treat yourself the way that you would treat someone you love, like a dear friend. That is where the self-compassion comes in, and I think it is incredibly important. The next area of self-advocacy I wanted to focus on involves relationships. So I have witnessed how many of the challenges during this journey involve pain and losses experienced in relationships. I received many messages about this, like with family members or friends. The challenges can vary, but some of the largest obstacles are related to POTS stigma and myths influencing opinions and perception, the unpredictable and invisible nature of POTS symptoms, how illness can make people around us uncomfortable, which doesn't need to be the case, but often can be. Some shifts in shared interests and activities, which can lead to changes and losses. And unfortunately, there are certainly individuals who have negative attitudes toward those with a disability. And this goes back into stigma and implicit biases contributing to these losses. I cannot emphasize how common and devastating these losses can be. And it can be shocking. It can be very surprising. You deserve to have supportive people in your life who will make an effort to understand, even if it's difficult or uncomfortable for them. So this is the last acronym that I wanted to review with all of you today, and I designed it to offer support with self-advocacy when in relationships. I would recommend combining this with the CHOICE acronym, but you'll see here that it includes prioritizing reciprocal relationships, setting healthy boundaries, encouraging those in your life to learn more about POTS and your other conditions, asking them what's helpful for them, and then keeping in mind that what helps most will likely change and be variable. It likely will depend on the relationship, and also the health of the relationship is a factor to consider and can have an influence. I've already mentioned a few of the barriers to self-advocacy, but I wanted to expand on some of the points here and have a dedicated slide. So medical trauma in the POTS community and chronic illness community is common. And honestly, I have yet to meet someone in the chronic illness community who has not experienced some form of medical trauma. Our trauma responses do tend to vary, but I've noticed that it is not uncommon for individuals in the POTS community to struggle with people pleasing and minimizing and or dismissing their needs. They're often used to putting others' needs first, sometimes reporting that for decades they have been accustomed to this. I think it's important to mention this here. I really do think it contributes to some of the challenges with self-advocacy. Other challenges are listed here and include poor support systems, co-occurring conditions such as autism, which can make self-advocacy more challenging, internalized stigma, and feeling like a burden. So feeling like a burden is not uncommon, especially in our community, and it can make it even harder for individuals to feel safe to be fully open. So I hope that we could take a couple of minutes to do a short self-advocacy reflection. So I'd like for you to consider some of these questions, and you can either think about them, you can jot some notes down on a piece of paper, you can write a little note in your phone, type something on your computer, whatever is easiest for you. We'll just take a couple minutes. All right, so I'm going to move forward with the rest of the presentation, but please, if you need more time, you can either keep working on this or you can come back to it later today or another day. So I briefly want to talk about creating realistic goals. It can be easy to slip into an unrealistic goal that perhaps is your end goal 1 year from now, but not something that is achievable within the next month. When setting goals, researchers have found a helpful technique and strategy uses a SMART goal format. It increases the likelihood that it's realistic and something that is manageable for you. And it's important to make sure that our self-advocacy goals are exactly that: manageable, achievable, realistic, specific, and timely. Wanted to review some reminders here for you as well. So some of you may be self-advocacy pros, and perhaps this presentation wasn't very helpful, but some of you may be new to the self-advocacy journey. So I hope that these reminders would offer additional encouragement and support. Please be patient with yourselves and offer yourselves grace. This journey is already hard enough as it is, and we don't need harsh inner critics to make it even more challenging. For those of you who are newer to the self-advocacy journey and interested in learning more with more practice questions and examples and PDF handouts, I did develop a very effective POTS self-advocacy online training as a part of my doctoral program. So it's free and available through our website, which you can see listed here. I have plans to expand the program for individuals living with other chronic conditions, but it will take some time. Announcements will eventually be made through our Instagram page, so you can keep an eye out for those if you're interested. But again, it's not going to be anytime soon. Overall, I wanted to share one of the other self-advocacy goals here with you, and that is that this leads to a path where thriving is within reach. Thriving looks different for all of us, and I'm not saying the journey will be easy, but ideally, self-advocacy will open that door for you as you advocate for your needs and find it easier to access supportive tools that offer additional opportunities for symptom relief. Here are the references used for this presentation. Thank you for your time today. It's an honor to be here with all of you. I hope that there was at least one takeaway from this presentation that makes a difference for you, even if it's that you realize that you're a self-advocacy pro. I will be at the Q&A today, so you can either submit a question through Whova or you can email me privately. Thank you.